Welcome back. Now to complete our discussion talking about influenza, joining me again is Janice Sheehan, the Manager of Communicable Disease at Tulsa Health Department. My voice is holding out, but it's starting to crack a little bit here with the laryngitis. Let's jump in here on our last segment. I wanted to come back and talk about how to protect people who are ill from others and others from them and that type of thing, especially like in the home setting. What can people do if you have a family member that is ill and you're helping to take care of them? How can you help try to keep yourself or others in the family pretty safe?
Right. Well, the best thing you can do is of course, put this person in a different room and keep them there until they get well, get to feeling better. And it's preferable that if you can, just have one family member take care of this person.
Okay.
And then that way, when they enter the room and exit the room, then they're doing good hand hygiene and those kinds of things. And there's a lot less likelihood of spread. And the person that is ill, stress to them how important it is to cover their nose and mouth when they're coughing and those kinds of things, and have the alcohol-based preparation there beside the bed so they can wash their hands after they've coughed maybe or sneezed, and just common sense things. In that in the home setting is the best thing that you can do. Just segregate the person into another room and have one person in the household take care of them.
Okay. Now some people may wonder, should I go out and buy masks? Would that help if I have a mask, if I'm the person that's taking care of them? I mean, if they wanted to go to that extent, is that advisable?
Well, if they would have to purchase what's called an N95 mask, because they have done studies now, and the surgical mask don't work. They don't work at all. They're not effective. You might as well just leave it off.
Okay.
But of course, if they wanted to do that, yes, then they could.
Okay. Okay. Now, if we're looking at, say, a school setting, and in different schools, of course, they may have health clinics that are of different sizes.
Right.
So there might not be the ability in the school setting to necessarily have a separate big room to separate people, but people can come into the clinic setting. Use of masks, that type of thing in that setting. Is that helpful in terms of trying to contain until the child or the adult goes home or the child is picked up by the parent?
Absolutely. And if masks aren't available, if you'll use, I would say 5 to 6 Kleenexes in your hand, just leave them fluffed up, put them over the nose and mouth. And here again, that's going to be some teaching on people's part, the nurse or whoever's watching the children there, and have them cover their nose and mouth when they're coughing or sneezing, and then just a little paper sack, if they could just drop it into a little paper sack right beside them, then make sure that you have the alcohol-based solution where they can wash their hands.
Okay.
Because anything that you can keep them from spreading the germs to, then you're that much safer, and so is the person taking care of them.
Okay, so people may say with that, so we're not really as concerned with routine talking, because some people may say, well, they're talking, so aren't we going to get it if they talk?
It's not respiratory, it's droplet. And to do droplet, you either have to cough or sneeze. And then it's carried in the water droplets, and you don't even see some of them. You can see some of them
sometimes depending on the level,
yes,
right?
On the force behind it. But,
okay, so that would be sufficient.
Right.
Now, the other thing in terms of the fever, before in the spring, sort of when the virus became the H1N1 sort of hit us initially, we had different recommendations in terms of when to stay home with symptoms and things like that, but that's changed with the CDC recommendations, and we're looking more at the fever concept. So in terms of fever, talk to us about that. When should a person think of returning to school or work in relation to that fever?
After they have had no symptoms or no fever for 24 hours, and that's without any Tylenol or any ibuprofen.
Okay.
If they've not had to take anything for an elevated temp for 24 hours and it's stayed normal, then they can return.
Okay, now what if the person, because some people will say, well, maybe they're still coughing a little bit or something like that. Can they still return because we're focusing on that fever? Of course, we want to make sure we're still using respiratory hygiene as we always should be doing.
Yes.
But are they still okay to return?
Usually, yes, and nothing's ever always absolute.
Right.
And but still, if they come back, they need to use the Kleenexes. So you're going to have Kleenexes. Yes, I wish I was in the industry.
Right.
But anyway, this year for that, and if each child just had a little sack, a paper sack, and then at the end of the class or whatever, they could fold that up and put it in the trash. If not, then they need to get up from their seat immediately and take that and put it in the trash.
Okay.
Not put it on their desk or somewhere else around that it might get knocked off because it's just full of germs.
Okay.
It could just be full of germs. And here again, we're going to go back to some common sense. If your child still doesn't feel well, don't send them to school.
Right, if they're still not feeling
Yeah,
well.
you know,
no
they
matter
need to
what.
have been up and stayed up most of the day and felt good and played and eat food, because you know when you have a virus like that, your appetite just goes. So just use some common sense. Just because their fever might be gone, they might not be ready to go back to school.
Okay. Now let me ask this other question in relation to a treatment of the particular influenza, whether it's H1N1 or whether it's the seasonal flu. Treatment at this point in time, because like I said, anything can change, but at this point in time is the same.
Well, with antivirals.
Right.
Now, the seasonal flu, there's one of the antivirals that it's resistant to.
Okay.
But we can treat the novel virus with it because we haven't got any resistance from the novel virus.
Okay.
So here again, that goes back to putting the weight of the decision on the doctor.
Okay.
Okay.
And once again, it's the same kind of thing. We're treating the symptoms, and the
Right.
symptoms for whether it's the seasonal flu or whether it's for H1N1, the symptoms are the
Same.
same.
Absolutely
the same symptoms.
the same.
Now, you'd mentioned in a previous segment, let's just look at this for a moment, about the rapid flu tests that they can do in the office. Clarify for us a little bit about that. When people say, what kind of rapid tests?
Okay. Well, they can do nasopharyngeal swab, and it's like a long Q-tip, and they absolutely do. They put it up in through the nose, but they have to get it back there far enough in order to get the correct specimen. And then they send that to the lab, and usually within a matter of hours they get a reading out. But we're not always getting, even when they're having the novel virus, the rapid flu tests are not always showing it. Now, I don't know if that's just because of the virus, or maybe the swab wasn't inserted far enough back into the nares and swabbed in the nasopharyngeal area. It could be how the test was done, but it could also just be the virus itself. So,
Okay.
but if you get a positive, then that's definitely, there are no false positives,
Right.
but we do get some false negatives.
And once again, it's telling us whether it's influenza A or not.
Right.
And with that, there is just the presumption, because some people are getting confused, that this is actually the test for H1N1.
No.
And it is not the test for H1N1. It's giving you a positive so that the presumption, like we said in an earlier segment,
Right.
if it is influenza A, more than likely it probably is H1N1.
Right.
But again, there's a small chance that it may not be.
Right.
So all we can say is for sure, it's definitely influenza A.
Right, and we're having so much right now, they're not culturing anyone, and
Yes,
that's the definitive
yes.
diagnosis,
Right.
unless you're in the hospital.
Right,
And, unfortunately, unless you die, and then
Right,
they
unless
need to
you die.
know, yes.
Right.
Then they do run the culture, because the treatment's going to be the same.
The treatment's the
going to
same.
be the same, and it's just, you don't really need to know that. It's nice to know sometimes, and they do have some surveillance sites that they are doing the cultures on, so we can keep a handle on really how many true cases that we're getting.
Just in general, right. And I think that's something too, as we're ending up here, to once again reinforce to people at this moment in time, the treatment is the same as seasonal flu. Right now, it's still showing a mild to moderate kind of effect, and we're keeping our fingers crossed that will stay the same.
Yes.
Should something change, of course, then recommendations will change. But until then, it is a strand of the flu, and we should approach all flu the same way in terms of precautions, not coming to work when you're sick, and covering your mouth, and all of those respiratory things that you talked about, and good hand washing for that 20 seconds.
Yes.
All of those good things. So that's what we want to let people know, to be aware, but not to panic, and
True.
just to be cautious, and it is influenza.
Right, and the best thing they can do is get their flu shots, both
Yes,
of them.
and both of
Both
them.
of
That
them,
is the
novel
last thing.
virus and the regular flu, seasonal virus.
That's right. You do need both, because they won't cover each other.
No, they don't.
Thank you so much for joining me,
you.
Janice.